We have with us Professor Jagriti Gangopadhyay, and Professor Jagriti Gangopadhyay is an assistant professor at the Manipal Academy of Higher Education based out of Mangaluru. So Jagriti, please tell us something about your work. What has made you drawn towards the questions of aging? Especially, as a sociologist, I feel aging is not that talked about, and it's still very much peripheralized and distanced within the mainstream sociology. So what made you drawn towards it?
Well, thank you, Sayendri. First, I want to congratulate you for this initiative. It's a much needed initiative where scholars, policymakers are all coming together and talking specifically about care and later life care, given that there is limited, even conversation on this topic. So, yeah, so I'll talk about this in the sense that, as you know, that sociology in general, when family sociology, there is lot of scholarship on marriage and also like generally family structures and caste within the family. However, very few scholars have actually delved into later life care or aging or the like grandparenting or intergenerational relationships. So these are there is very limited scholarship and the scholarship that does exist is very quantitative and it's more in line with demography, population studies than sociology or even social and cultural gerontology. Like the gerontological scholarship is also very economic driven and like it's very much related to living arrangements. So essentially, I started working on this topic during my PhD, and my doctoral work is a comparison between different aging practices in cultural contexts. Particularly, it's a comparison between India and Canada. So, with regard to that, I with a specific focus on intergenerational relationships and relationship between grandparents and their adult and their own grandchildren and their own children like that. So that's what got me drawn because I was also interested in the future of aging in the sense like, and of course, one key factor is that we all have aging parents and aging in-laws in that sense. And, my own position as a researcher also is important here because I don't stay with my parents and we often have to rely on long distance care, like digital care, and provide care on at different, like levels. And though in India, much of the focus is on family, despite that, there is so much limited policy or scholarship available. So there, I thought that much contribution could be made. So that is why I am drawn. I was drawn to the topic because of that.
Right. Yeah, it completely makes sense because when we look at the larger corpus of gerontological literature, still the ideas of productive aging and successful aging continues to capture the popular imagination, which definitely we know it's not true. Could you share your PhD journey with us? What was it like to work on a topic on aging and what kind of responses you had back then?
Yeah, so you're right. I actually did a comparison of different theoretical models. And because it's in the globe, part of it is in the global north where successful aging is very, because, now the other thing also to understand is that we belong to a neoliberal idea of care, right? Like where there's so much focus on self-care and then aging is also redefined in the sense you have to be active, you have to live your life after retirement and also getting a role in your life, like having a purpose. So mostly my age group was in the age group of 65 to 80 in that sense. And one of the major differences I saw, so in Canada also I interviewed older Indians who have grown old there. So one of the major differences I saw was that in the Indian context, there is a lot of expectations from family to look after older parents. Like adult children have to provide that later life care to their own parents. And that is a very crucial component of aging in India. That despite the rise of old age homes and despite paid caregivers, despite so many different intrusions of the market in our life, but we still have this expectation from family, and which is why even now people are choosing not to get married. Like there's rise on singlehood and child-free adults. One of the major reasons people are still having children is because of that idea of later life care, and because legally also there is, like a push towards that, because the government policy is also inched in that sense. So one is that, and secondly, the other point in Canada was that there is not much expectation from family, because people have learned to be very independent and self-reliant, and the government them itself provides a lot of later life care for its older population, because the rising older population has made it like the government to push into thinking in that sense. So these were some of the major responses. That one of the crucial responses was that older Indians in the Canadian setting actually told me that they are very happy to have their own self-sufficient, independent, even for their emotional needs. They rely more on the community, on their own network society, as opposed to like their own children who spend time with. So that's one of the major things.
Right. I will ask you something related to policy towards the closure of our talk. But I also wanted to know from you that of late, I have seen that you have grown interested towards aging alone.
Hmm.
This is something you have been working on and you have been talking about it, as well as non-traditional forms of aging in India. I think you have recently delivered a talk for the Center of Care
Yeah.
attached to the University of Sheffield. So, if you could take us through your recent interests and why do you think that the current crop of sociologists or social gerontologists should be studying this?
Yeah, so as you know, the new recent census is not out, so I don't have the latest statistics. But as per the last census, like 5% of India's older population, like 8% is the total population, out of it, 5% is actually living alone, and more so in the urban areas as opposed to the rural areas. So gradually, aging alone is becoming one of the major challenges. Like that also is associated with the larger question of elderly abandonment, elder abuse, loneliness. Now, loneliness is a major problem in the Indian context in that sense. So, one of the reasons why I'm looking at that is because India is now gradually shifting from family care to other forms of care. And I have myself seen a lot of rise of paid caregivers. Like that's actually become a very, like specifically older adults with terminal illnesses, because cohabitation with adult children is gradually declining for many reasons. A, because of older people themselves don't want to relocate. They would like to die in the city they grew up to. It's because of nostalgia. It's because of attachment to their own ancestral house, dying in their own space. So because of that, many older, and as you know that now a lot of private hospitals are actually providing these care, assistant forms of care, which is trained nurses will go and stay with you, and a lot of the adult children are monitoring the parents constantly through CCTVs. So that's why I was interested in looking at this non-traditional form of care. That is because this is very much on the rise, because older adults now gradually choosing to live alone and remain independent is one of the core living arrangements which has not really received much attention in research. That was one reason. The second reason is also to understand in a post-pandemic, world, how digital care is very much on the rise, right? We all provide care through online apps, or particularly I am doing interviews where I'm talking to adult children who live abroad, and one of the older parents is living alone in India and doesn't want to relocate in the US, or in the first world in that sense, with their adult children. So they actually heavily rely on digital care. So that is the other thing to understand. And the pandemic, one thing they have taught us is that that might be the future. So this digitalization is also something that I'm looking into. And finally, the other thing I'm very interested in knowing is the care provided by male spouses and divorced male sons. Like there's very little scholarship on that, and much of the scholarship is on the care provided by daughter-in-laws. But now there are new forms of care, like daughters are also becoming caregivers, male spouses, then also like divorced sons. So I am exploring those relations, because the idea of care is changing in India. That is well.
Right. Drawing on from what you say that the idea of care is changing in India. Based on your field insights or your observations, where do you think that rural aging and urban aging is currently, and the situation of rural and urban aging is currently in India?
Yeah. So in urban aging, as you know, there is some financial stability among the older population because still the bulk of older population actually receive pensions. We have to see what when that demographic when there is no pension like that, then the idea of aging will be very different. Lot because there is many older people who are still receiving pension, so they have some financial stability, or they can rely on their personal savings. They have their own property. They mostly own a house. So there is more. One of the major factors of urban aging is there is financial security. Rural aging, one of the biggest challenges is elderly abandonment, right? Like the reason why help-age, of course, is playing a large role, or other NGOs also like rescuing older people in those rural settings is because many of the times when there is migration from rural to urban areas, they often do not wish to relocate with the older person, and likewise there is because there's lack of social security. So, and now with agriculture completely on the decline, there is very, like this is one of the major differences. But having said that, urban slums also, the aging population is actually, going through quite a bit of a challenge because many older population, like particularly older domestic help, I did some research there, they are still working, like there's no retirement age. And while they cannot do certain kinds of work, like they cannot do cleaning and washing, but they are still cooking, or they are still providing care for young children, etc. Because the point is that if they retire and their wages are stopped, there is no savings in that sense. So this is the fallback. So one of the biggest challenges is that of lack of social security for the older population. And now, though they have been included in the Ayushman Bharat scheme, but like healthcare is still very expensive. And like public hospitals, like India's public health system is also pretty much, like just shaken by the pandemic, as we know. So affordability of care is also one of the major reasons. So while there is some financial stability in the urban areas, but one of the major similarities is that lack of any form of support from the government. So that's the major challenge across India.
Right. So, what do you think would be some of the most effective and feasible steps
Hmm.
that, say, the different stakeholders can adopt to address the varying concerns of the rural population as well as the urban population, but it could be the rural urban continuum as well?
Yeah, yeah. One thing is, of course, the state to take notice and understand that family cannot be the future of care. They have to provide support, particularly to older adults without any form of social security, like specifically in rural areas. There has to be some form of, like basic pension. Like now, this conversation about the starting of pension, but at least to provide some support for definitely. Now, of course, aging is also different, like to the oldest old population at least, because now longevity is so much on the rise. So to maybe dissect aging, not to see aging population as a homogeneous category, but to dissect and have different categories and support in that sense. Second, I think we need more, like civic organizations like NGOs. Like we have very few NGOs who actually look into the problems of older people. We need more NGOs devoted specifically working on this problem, on the problem of aging, to provide more solutions. And like that way, also more policies will be created. And finally, I think like external community, like in the West, the community really come together. Like there are so many events that are organized for older adults, like community gardening. Like even if in urban area, if I because my work is so much situated in the urban and loneliness is such a bigger problem. More and more older adults need to be involved. Like one of the things that could be done is like older adults like old age homes and orphanages could come together and there could be some interactions because that way, like there is like solving two problems together. So these are some of the factors that need to be addressed. Like these stakeholders need to come together. And I think we as a society have to really come together as a community. Like one thing I saw during the pandemic was a lot of people came together to provide groceries and medicines only to the older population. So we need to rethink of, like everyday life for the older population in that sense.
Right. When we are talking about older population, we know that they are not a homogeneous category, or there's not one kind of problem that pervades older population across the spectrum. And I also remember that you have been interested in talking about the issues specifically faced by the older women. So could you please take us through, what are the peculiarities that besets older women, and since you also have that comparative lens between India and Canada, so if you could bring in that perspective as well.
Yeah, yeah, you're right in saying that one of the biggest problems is that older women in India are much more dependent first on their husbands and then next on their adult sons, because most of them are illiterate and very little education. They've never worked, and even if they are pension holders, they're very much dependent on their adult sons to have any access to money in that sense, right? The most of the money is taken within the family, and just some amount of care is provided to them. So older women in urban India, in that sense, are very much dependent on other family members. They have very little voice, and they are very dependent on religion and ritual activities also, because several of them gradually also lose their power within the household. And specifically, there is a transition after the death of their own husbands, because while there's no scientific reason as such, but as we know that older women often live longer than older men, and their problems are paramount. That is because of their lack of education, lack of access to mobility, which is why we have some old age homes which are state funded, where older widows can be moved and they can grow old there. But the conditions of those old age homes are not necessarily the best and need much intervention in terms of care. Whereas in the West, as you know, that older women, they're pretty independent, like they know driving, they have themselves acquired a certain amount of education after marriage, after having children. They do part-time jobs, and because they feel this need for independence, because of this whole push of independence and neoliberalization is so much there in the North American context. So that is why there is this need to go on about it. So that is like older women over there are very much independent, and like even in the oldest old category, they can do things on their own. So that is why like they are not clueless. They very much know that what medication to take, then like how to live with a paid caregiver, or even to like use technology. Now there is slight change in adapting to technology in the context of India, but mostly, as you know, that even within men and women, that older like women often don't even have access to a smartphone, right? So because of those reasons, then that I would say is an inherent patriarchal structure that is there in the Indian society, which trickles down to old age as well.
Right. Uh, One thing, I have always been bothered with the mainstream scholarship as well as the popular discourse as well, that how, when we want to talk about issues of aging, there has been kind of cold response, or there has been, a way of not talking much about it, unlike other issues that occupy the center stage. So, what do you have to say about it, and what we can do to raise awareness without being condescending?
Yeah, so as I said, that one thing is that media can play an important role, like different media platforms. Like if there is no writing on, issues of older adults, and if there are some, like now there are some advertisements, but more in the private sector. But if there are more public sector ads with respect to the real problems that older adults are having, and as I said, that much of the scholarship is very quantitative, like how many people live alone, what are like, but to really understand the why question, we need more qualitative studies to understand, like pan India, what are the, like, and do like a city region wide analysis to really understand what are some of the major challenges that our aging population is undergoing. And then, without condescending, being, like in that sense, condescending, we can actually come up with real solutions, because part of the problem comes is that we often assume certain problems and then we make policies, like we also lack representation, like when we are making policies for older people are not really there to make their own policies, right? So they also have to be really included to understand what is it that they are going through. So that will also lead to some major changes. like to an pan India.
Right. So, I mean, as of now, you have been discussing, or rather, we have been discussing about the baby boomer generation of older population. What about, I mean, what kind of trend do you see? I mean, we have for the eco boomer generation or the millennials, as we are also aging, we are in the process of aging. What do you think will be the future trends of aging?
Well, one of the major things I think is that, now as you know that in our generation, health problems also start earlier, right? Like many people are getting their hearts checked at the age of 30. Like we belong to the pill era. Many of us are taking different forms of pills because of we are exposed to more pollution. More of our generation is working, so we are exposed to more work-related hazards as well, our mental health, etc. All of these things, So one of the I think major changes that would happen when we grow old is we are also exposed to the like online world more. So that also has its repercussions. And I think one of the challenges is that we will have more health issues to deal with as opposed to the other generation because I think of our relationship with work in that sense because more and more like see so many children are now going to daycare. The earlier generations children would mostly grow up at home, right? And now there's also a booming of daycares because that's where parents are mostly relying on, that like the whole neoliberal idea of care. So with respect to that, I think that we will have to deal with more, in that sense, problems with health. And I think we will rely more on paid caregivers because there's no guarantee now that our children will be providing care because there is so much shift and job demands are so hectic and so demanding that increasingly I think we will rely on different forms of technology. Maybe AI is the solution to our later life care. Like we shouldn't forget that. Yeah.
Right. Uh, so on one hand, we see that there is a very negative image of old age homes, right? How it stands in stark contrast to the grand narrative of Indian values. On the other hand, we are also seeing a parallel trend where extra aging care facilities like those gated condominiums for older adults eventually coming up, especially in these metropolitan cities. Uh, any insights, any observations on that?
So I have not got real access into many of the old age homes because it is very difficult to get permission. But pros and cons in both. The pros are that it comes with a sense of security. It comes with a sense of protection and safety because there are so many crimes against older adults now, and maintenance services, which is why increasingly a lot of older adults are selling off their ancestral property and moving to these gated communities because it's the burden of maintenance if you just pay a fee is taken over by an external third party. But also, I've heard, and part of my research was also there that during the pandemic, there was very strict surveillance and guidelines, and the gated community sometimes, or even the old age homes, they themselves become like moral police, and they start practicing a different kind of morality. Like many older adults in old age homes, like scholarship also has shown, say that essentially they have to sleep on time, they have to eat only this kind of food. There are so many restrictions, there are so many constraints. And one of the things that happen when one is aging is that one believes that this is just the last 10 years of my life. I would just like to do what I want. That freedom is taken away. So while it comes with the advantage of a lot of security, but often many older adults are not sure of shifting into these kinds of property because it takes away their liberty and their freedom and their autonomy. So I think some kind of a balance is to be brought about, which will actually relate, like finally convert into like a more positive experience of aging in these communities and society.
Right. Uh, I think I mean, this will be my second last question to you that what can we do as an eco-boomer generation or a millennial, whichever way we would like to put it, to make our older population feel integrated, loved, and beloved?
Well, actually, I think the amount of time we spend on social media or the amount of time we spend on other activities, we can just start at home. Like I think we should definitely spend more time in calling our in-laws or our own parents, like how much time do we actually spend with our parents? Like more than, like just if we were to do a small thing as researchers, I think is that we should actually provide quality care from, like to older people who are there in our own house and just to understand or to try to solve some of their problems, try to take some of their responsibility. And I think that if we as researchers start doing that, then gradually, it will start spreading across the community. Like I think we need to take more responsibility of the older generation within our own houses because instead of relying so much on the market and paid caregivers, if we ourselves try to provide at least some form of emotional care also, then there will be a major change in the whole system.
Right. And my final question to you would be, you have been working on issues of aging, intergenerationalities, later lifehood for quite some time. How do you look at yourself in terms of, have you experienced changes in yourself because you have been working on something that you feel is very sensitive, and it's also about human decline. It may not always be easy. You also have to cope and come to terms with issues which are often inexplicable. So, if you could please share that with us.
Yeah, one thing I think I myself have seen as a researcher is that I often think that these are when I'm asking a question to respond, that eventually it is very much drawn from my own life. And these are the problems, that I also face with, my own parents or with my own family members who are old. And one thing I definitely try to do is develop more patience because one thing that happens is it's hard to explain things to the older generation because sometimes they fail to understand our work commitments, our work requirements, and to patiently address those problems and also to try and help as much as possible to be there for them. These are some of the internal changes that I definitely try to do. But also, I think in the larger level, at the level of the policy, I think a lot of support needs to be drawn and provided because I think, as we know, that India's older population is only going to expand significantly. So it is very important that change comes at that level to provide like a larger support system, and that I think is very much needed.
Right. Uh, Thank you, Professor Jagriti Gangopadhyay, for your time, for your expertise, for your insights, and mostly for being such a sport, for agreeing to do this for Sabr. We at Team Sabr, we are very grateful to you for your for sharing your knowledge with us. As you know, this is such an underexplored area. We have very few social gerontologists in our
Yes.
country, and I'm sure that this conversation, when it will reach to a wider audience, it will definitely inspire people to, continue the conversations and carry forward the pattern. So thank you so much, Dr.
Thank
Gangopadhyay.
you. Thank you so much, Sandy.
Right.